Non-Communicable Diseases Alliance of Kenya has been implementing what we'd say is an inaugural training for media personalities on the aspect of brain health. This is a new concept, well, relatively new concept, especially in our country, but really it's really just to create awareness about brain health and what the difference is between brain health and mental health. And for us to understand that brain health actually starts from even preconception. So everything that we do as we grow up actually has an impact on our brain and our brain health. So even as we age, this has a lot to do with the way that we lived our lives as children, as young adults, and even as young adults, adolescents. So all of these stages of life have an impact on your brain health.
Mental health and brain health are often used interchangeably, and they aren't the same. I think the key takeaway that people leave with is that actually brain health is something that starts from a very, very early age. That you can do things to ensure that when you get older, things like dementia can either be delayed or, that you understand what it is that can bring it on, so you can stop behaviors like cigarette smoking or alcohol drinking, being able to see that those are the elements that affect brain health and that you can do something about it at a young age, I think is super useful.
The most common one is memory. That is the most common one, where your memory goes. You don't remember where you parked your car. For those who drive, what dresses they had. Maybe they are wearing a dress and they want to add another one on top. Those are now the telltale signs that somebody's brain is not well, it's unwell. Then another sign is wandering. They get out of their house. They don't realize where the door is or the gate to the house is. Those could be telltale signs. And then just change of behavior and repeating the same story. A friend of mine the other day, a colleague in NCD Alliance, traveled to Moranga, and he had never stayed home for more than a week in his homestead, and he was hearing homestead by homestead, they're affected by the disease. He called me, Monica, it seems that this disease is prevalent. It's coming up, it's common, but we don't have the data, and we hope you can have data soon. Brain and Mind Institute, based at Aga Khan University, is working hard to get those statistics out. There's so much research going on, so we hope in the next 5 or 6, 2 years or 3, we can have the data and we can be able to speak about it. We can speak to policy, because right now WHO has passed a law that dementia is a going concern globally.
The aspect of using data for stories in journalism, and the fact that there is data available in different data sources, but I think the majority of us don't know how to access it and don't know how to use the different databases which are available. So at least from this training today, we had a session on data for storytelling and how we can access globally accessible or available data sets, and how we can actually use those data sets to explain different concepts and really just to provide evidence for the stories that are there, and how therefore we can really just make cases for aspects of brain health and other non-communicable diseases.
You'll find that people are radio. There were a lot of people here from radio. I think radio is an incredibly powerful tool. And obviously you don't see a visualization when someone is on the radio. But I think for that and for WhatsApp, those sorts of tools, I think what is useful for journalists to understand is that data gives context to a bigger picture. So you have anecdotes, for example, a case study, somebody will be saying, oh, there's a person here that is suffering from dementia. Being able to see the big picture is extremely useful. Being able to interpret that data in simplified language is important. So being able to give people the big picture, but use words that mean things to people, not just the stats.
It's a new awakening that you are reminded, hey, you can always refer to data. You can always present your data in a different manner. You can always simplify data. You know, it's something that we've not been doing. So yes, the challenge is now let's embrace it. We have undergone the training. We know the people we can refer to. We know the websites to refer to, or even the tools available online for use. So the biggest challenge that you now have is now making use of the knowledge and also introducing it as a culture to our newsrooms. For instance, if you are handling a professional thing, is there data that is backing up your story? Apart from the human sources, the office holders, where is data? Even if you're engaging an office holder, it's easier to ask for data than to ask for their comments. If you have data, if you have certified data, it makes it easier because the records, you know, will always speak for themselves rather than the human being who will leave the office the next day. Data is data and it will remain.
The digital tool is the first of its kind that I'm aware of. What is extremely useful about it is that it pulls together data that is usually all over the place, and it brings it together in one place so that if a journalist is interested in data about brain health, they can go to one place and find it. It's also been put together so that the sources and any information that you need to know about it is there. So you can verify, you can be sure that it's reliable information.
I am looking forward to create even content that is that will be showcased on digital platforms, even on social media, because if I did not know, then it means so many people also do not even know, they do not understand, and I would be able to bring out information that relates to them and also showcase how this is also affecting their lifestyles, also their value of life as they live. Therefore, the kind of content I'm gonna put across is content that has data in it, with solutions if there are any, according to what I'll be putting across. Through radio, many people will get the information. I break it down to a language or information that they can digest easily without having to go through the problem of breaking it down, the scientific words and the jargon that is there. So I used my local language so that people can understand.
The training also touches on using simple examples. For instance, you'll say that one pot or one matatu full of so is compared to half a matatu. You know, to even that grandmother down in the village, if you say a matatu, you know, full of people, those are 14 people in the Kenyan capacity, somebody will want to say, okay, a whole matatu like is in danger because of this data compared to this. So if you simplify it in the simplest comparable language to the commoners, whether somebody has gone to school or not, it helps. And those are some of the things you're told. Don't go for the millions and billions. Just simplify it to the closest jurisdiction of a person.
Brain health is like any other disease. It's like diabetes, it's like hypertensive, it's like HIV. Let's speak about it. Let's speak in our churches, in our public places like barasas. Let's speak at like the way we spoke about diabetes. We spoke about HIV because it's becoming. We are living longer, and since the risk factor of dementia is older persons, we are living longer. So you will have one or two people who may be struggling, or your neighbors will be struggling. So before we struggle, let's speak about it.
Cognitive decline is a non-communicable disease, and now with the aging populations, the number of individuals living with dementia is increasing, and this is something that the government is recognizing. They now do have a division in the Ministry of Health which is dealing with healthy aging, and this is where aspects of dementia and other diseases of older persons are housed. And yes, there is a dementia policy which is being developed by the government. So there are steps to actually address this issue. The government has recognized that yes, with the aging population, and even with the lifestyle that we lead and with all the other risk factors, the number of people likely to be diagnosed with cognitive decline is going to increase. So the government is trying to at least try and prepare for this by developing policies and other guidelines. Obviously, it is not enough as it is at the moment, but at least that's a step in the right direction. And we hope that even as we create awareness about dementia and other neurological conditions, they'll be more acceptable. People living with these conditions will be more acceptable in the communities. They will no longer be stigmatized. Of course, issues of dementia, they're tough, they're difficult. I mean, forgetting everything and maybe having to be reliant on family members or caregivers is a big burden, even for the person living with with dementia. Just to recognize the fact that they can no longer be independent in many cases. So it is a, what would I say? It's a severe condition on both the person living with the condition as well as the caregivers.